to Saltmarsh, Cleveland and Guns. We think number 5th in a series on CARES Act PRF reporting instructions and recent updates. I'm Andrew Kent, shareholder here at the firm. Presenting with me today is going to be Claudia Reingruber, who I know many of you know, managing director in our healthcare practice. The session is being recorded today, so a couple little minor housekeeping items. The session is being recorded today. Everybody's been muted for the convenience of everybody on the call. If you have a question during the call, please feel free to put it in the chat. We've got a lot of information to cover. We may be able to get to some questions before the end of the call. If we don't, we generally try to aggregate all those questions and we report back out in an email to the entire group. If you're registered today, you will get a link after we finish up to our YouTube channel, where all of our webinars can be watched online at your convenience if you have insomnia or want to go back and revisit something we've talked about today. You'll also get a link to download the materials, so you'll be able to download our slides for the show today. And just a reminder, we make every effort to be current. We've done everything we can to try to bring this presentation current through July 20th. But obviously, we're in a rapidly changing environment here. I'm sure everybody on this call today has been living that for the last 18 months. And so, you know, before you take any action, ultimately, we always recommend to go back, check the HHS website for the most recent updates, check the FAQs, make sure that something hasn't changed, because things literally change on a daily basis. Though, so far this morning, no new FAQs. So with all that being said, that's our housekeeping. We do have a lot to cover today. The focus of today's session is just going to try to be an overview of where things currently sit from a reporting standpoint, go over the recent changes to the instructions and reporting. We're not going to get too terribly deep into actual calculations today. We just don't have time in the 1-hour format, but we probably will be scheduling additional webinars in the next few weeks to delve into some of the more detailed calculation questions. We're also watching the FAQs and the guidance around this issue. We have guidance changing as recently as the 15th.
Actually the 20th.
Actually the 20th, that's right. I was thinking the most recent presentation from HHS that they haven't even published yet. So lots of changing coming. So today's topics. So today's agenda. Just real quickly, we're going to cover the new PRF reporting instructions. We're going to cover the PRF reporting resources from HRSA, changes to the reporting time periods, been some big changes there, more time to use and report on PRFs, responsibilities for reporting, changes to the data elements that have to be reported. We're going to try to cover some of the more significant FAQs and go over a few of the questions and answers. And we tried to throw in a few comics. I don't know about our audience here, but I'm a big Far Side fan, grew up with them. And I know a lot of you guys feel like our two pilots here in this comic. We've been all flying through clouds, just wondering when it opens up, is there going to be a mountain in front of us, or is there going to be a runway? So with all that being said, I'm going to hand it over to Claudia, who's going to take us through the first half of the presentation. So Claudia, it's all yours.
All right, thank you. The most important new piece of information came out on June 11th, 2021, and that was a revision. Actually, not a revision, but it superseded all preceding instructions on how to report on your PRF payments. So if you haven't seen that, I would suggest you pull that down. We have a resource slide at the end that will tell you, how you can access all of this information. So disregard all of the prior notices and use the June 11th one as the final reporting instructions, at least at this point. They have now included the SNF, Nursing Home Infection Control Distributions, and the QIP, or Quality Improvement Program incentives, are now part of the PRF reporting requirements, and that was not the case in previous notices. They also have established and defined new terminology that really affects how the PRF payments will be reported, and this is very important. We have a new term for payment received periods, reporting time periods, and the period of availability. So we'll go through the definitions of these and give you an updated chart that shows what these terminologies mean and how it's going to affect the reporting process, because these are significant changes. And it clarify reporting responsibilities. We're going to talk about that, and also outline the order in which data is reported. The government has defined how that needs to be reported, and that is in the reporting instructions. So Andrew will be talking about this a little bit later. In addition to the June 11th notice, there was also a July 1st update to the frequently asked questions. And then there was a July 15th update to the frequently asked questions. And then they have been presenting webinars, or what they refer to as technical sessions, where they discuss these requirements. And the technical session on July 20th contained some revisions to the chart that we're going to be talking about. So just want to make you aware of that. And with that, we can go ahead and go on to the next slide, I think.
Excellent. And Clay, just point out, and I know this is like this June 11th notice was, I think, like the 4th or 5th major revision, and it specifically replaces the last one, which was January 15th. So
I think it might be closer to 7 or 8 of them.
Yeah, all right, next slide.
So this is the chart that you're going to see in the June 11th, 2021 notice of reporting requirements for PRF payments. We have now 4 reporting periods, not just one. We have 4 reporting periods. The reporting periods are defined based on the payment that you received during those periods of time. So, for example, the first reporting obligation you're going to have is for period number 1. And the payments that were issued, the PRF payments that were issued began on April 10th. And this payment period will cut off any payments received as of June 30. So there's not going to go beyond that. So you're going to be reporting on PRF funds received from April 10th, 2020 to June 30th, 2020. Now we've crossed out the next part of the chart that was on that was in the June 11th notice, the deadline to use funds, because they have revised that, and that's an important revision, and we'll go over that. They've also renamed this column as the availability period, so we'll talk about that as well. And then you have your reporting time periods that are in this last column. So with that, let's go on and look at the what was presented on July 20th in the technical session that was held. And it's important to know that these technical sessions, they have promised that the slides and the recording will be made available on the website. That has not happened yet. So you won't be able to find this information necessarily on the website. There were 2 technical sessions held. The last one was on July 20th, and this is the chart they presented during that session. And what this says is that the period of availability as revised means that you now have the ability for each of these reporting periods to use funds received. You can use those funds you received. Let's take the first reporting period, for example. So that's April 10th, 2020 to June 30, 2020, funds received during that period of time. And you'll all remember that many of you went to your bank accounts on April 10th and discovered you had some extra money that CMS had sent you and that you didn't ask for, and they didn't tell you they were going to send. So what this period of availability means is, even though those funds were received between April 10th and June 30th, you will be able to use them for appropriate expenditures and lost revenue, those things that are related to COVID. That you used in order to prepare for the COVID virus and take care of patients. You can actually apply lost revenues and expenses retroactively to January 1st of 2020. The government has said that they don't expect that anyone will have any expenditures related to COVID prior to that, but you will notice that all 4 of these periods all 4 of these reporting periods have the January 1st, 2020 date as the first date of the period of availability.
So, Claudia, this is clarifying one area of confusion, because for many of our clients, we know that they got the bulk of their funds prior to June 30th, but we also have clients who received the bulk of their funds in December. And there were some questions about how far they could look back. to establish the use of those funds. So what I think they were trying to clarify is that even if you got funds in December that were outside of period one, you can look all the way back to January 20th to establish expenses or lost revenue.
Right.
Funds, correct?
Exactly. And the period of availability extends all the way through December 31st of 2022 for the period number 4. So that also, they've been much more generous in permitting use of these funds. That was something that the industry and many stakeholders asked them to do, and they have done that. Another thing that this chart indicates is they have also expanded the reporting time period. So now you have 90 days to report, and which is more than what we had previously. So the reporting portal is open now, but we're going to talk a little bit about what that might mean for you. So the next slide goes into the reporting instructions themselves. So we have these 4 reporting periods. You report in a period when if you received in that payment reporting period, if you received more than $10,000. So if you received more than $10,000, you have to report. If you received less than $10,000, you do not have to report. So the line separating those two categories is once you hit that $10,000 in a reporting period, you will have to report. If you get less than that, you don't have to report for that particular period. And that is an analysis you will make every single one of these 4 reporting periods to determine if you received enough provider relief funds in order to meet that reporting threshold. So if you get $10,000 or more, you do have to report. If you receive $500,000 or more, then you've got, not only do you have to report, but you're going to have to report in more detail. And Andrew is going to go through those requirements. The way you determine when the date of receipt of these payments is the date that you got the ACH payment and the when it showed up, the automatic clearinghouse, when that ACH payment showed up in your bank account, that's considered the date of receipt. If you were one of the smaller group of people who got a paper check, then the date of receipt is the date that check was cashed. So that's how you will determine which of these 4 payment periods your provider relief funds will fall into. And so you may want to go, we're going to go ahead and continue to proceed through the discussion, but you may want to refer back to that chart on slide number 6 as we go through. We couldn't, we wanted to go ahead and have more detail to discuss what those various columns mean. So PRF payments now include, in the reporting portal, you are obligated to go ahead and include as we said, the SNF and nursing home infection control distributions. This also includes the quality incentive program payments for those of you that met the criteria for receiving those. And this is new because previous notices did not address how the SNF and nursing home infection control distributions were going to be handled. So this is new. Those nursing home infection control and QIP payments are considered targeted distributions. So that's how they will fall in the reporting portal.
And we'll talk about why that's important a little later, right, Claudia? Because there's some registration differences.
Yes.
Based on whether they're classified as targeted or general distributions.
Right. These reporting requirements exclude rural health clinic COVID-19 testing program payments and claims reimbursement from the HRSA COVID-19 uninsured program and the HRSA COVID-19 coverage assistance fund. So that's important. If you're a rural health clinic, you do have some reporting obligation. We'll go over that when we get to some future slides, but it's just this the RHC COVID-19 testing program that's excluded from the PRF reporting responsibilities through the portal.
All right.
Okay, and then the period of availability. This is what they were previously referring to as the period in which you could use the funds. Now they're calling it the period of availability. And so it's sometimes if you're in the single audit arena, you may hear this referred to as a period of performance, but this is the terminology is period of availability that they're using in the instructions. And this is defined as the period during which the funds may be spent on eligible expenses or lost revenue. So this allows us more time to use the PRF money, as we explained earlier, based on the July 20th technical session that was presented through on the HRSA website.
And Claudia, I know we're going to touch on this later, and probably there will be a whole other webinar, a follow-up webinar on the single audit requirements. But it is important to remember that many of our providers I know are thinking about all these different thresholds and the $750,000 threshold. The period of availability does not necessarily align with the period in which you are measuring whether or not you reach the $750,000 threshold for the single audit requirement. The period of availability may be shorter. That $750,000 threshold is typically measured over an entire year, correct?
Right.
Just something to keep in mind as you're looking, because it is starting to get more and more confusing with all the different periods and the deadlines and the different thresholds. Just something to keep in mind.
And we have done, and we'll probably do in the future, a presentation just on the single audit requirement for those that have expended more than $750,000 during a 12-month period their year. And we have one webinar that we've done already, and there have been some changes that we're going to highlight at the end of the presentation in those rules, but and we'll present that information going forward as well. So if you have any questions about the single audit or the program audit or any of that, go ahead and put them in the chat box and we'll follow up with you. So the next slide is, and Andrew, you want to explain the cartoon?
Well, once again, our Far Side cartoons, time actually is money. And I know many of you have been looking at these deadlines and trying to figure out what the timing means. And so I think, Claudia, this slide is touching on some things we've already touched on, but I know we want to highlight again.
Yeah, exactly. So for each of the payment received periods, the new instructions provide more time to use and report PRF funds. So we highlighted or bolded the beginning date for each of those periods, meaning that your expenses and lost revenue attributable to COVID are going to vary depending on the type of provider you are, the type of PRF payments you got, your geographical location, because the COVID virus and the rapidly spreading Delta variant may affect providers differently depending on all of those factors. So this is important because it provides an extended period of time backwards to January 1st, 2020 to use those funds to cover appropriate COVID-related expenses and lost revenue.
Like I said, we know a lot of providers got their money in the first period, but we also have providers that received substantial funds in the second period and had a question as to whether or not they could look back to lost revenue, for example, incurred in calendar quarter 2. So
yes. And the reporting time period for each of these reporting periods was also lengthened. We mentioned that you now have 90 days to do your reporting for each one of those 4 reporting periods. So that was good news as well. And that reporting period begins on the day after the end of the period of availability. So that's another important distinction.
The current reporting period, Claudia, then is for period 1, which is funds received through June 30th of 2020.
Right, of 2020, yeah.
And the use period, those funds were available to be used through June 30th of 2021.
Right, so we had a whole year to use that, all the way through June 30th of 2020.
Really a year and a half.
More than a year.
Yeah, January 1 of 2020.
Right.
And we'll touch on this later, but we are also, I think you and I are both thinking, we're recommending folks, if you receive funds in that first period, we're still, even though the portal is open and you can go report now, we're definitely of the opinion providers should be probably waiting at least another 30 days, probably till towards the end of August or early September, because we are continuing to get guidance from HHS and continuing to get refinements. And this is one of those situations where being the early bird may not necessarily be advantageous, right, Claudia?
Right. The technical sessions that I listened to both of them, and the one on July 20th, there were lots of questions that they addressed, and there were lots of questions that were being submitted in the chat box that haven't yet been addressed. And I think this, as people begin to understand this and they apply it to their own unique situation, more questions are going to occur that they haven't even addressed yet. And it's probably important to let the dust settle before you try to before you try to go ahead and report in the portal. A couple important points about this. Number one is that if you haven't registered yet, you need to register in the portal. So if you haven't done that, that's the first step you want to do. And the second thing is that this next point here, that reporting must be completed by 11:59 Eastern time. It's Eastern time. So if you're in California, I know we have people coming from all over the United States or who signed up for the presentation. So, getting it done by 11:59 Eastern time is going to vary if you're in Arizona, if you're in California, if you're somewhere in the middle, you're going to have to pay attention to that. Once that deadline is passed, that's it. Your funds are considered subject to recoupment if you have not completed your reporting. So even though we're cautioning you not to do it too early, definitely don't do it too late either.
I was going to say the same thing. Just because we're recommending you don't necessarily jump in right now to report, we're also not recommending you wait until. So if you're on September 30th at 11 o'clock and worrying about whether you're in Eastern time or Central time, you don't want to be in that position. So
right.
Next slide.
There's a lot of other time zones. I didn't even know how many time zones could cover the U.S. and the territories. So Samoa, for example, and Hawaii, when you start getting into all of that, you're going to have to be careful about that deadline. And there are a lot of resources. One of the things that I think has been will be very helpful to people is that they issued this June 11th notice, but then they published all sorts of other, there's a lot of other available information on the website. There is those technical assistance webinars that are already completed as of July 20th. But they include the webinar, the recordings, and slides, which they said would be reported or posted on the website. The first technical assistance session was pre-recorded, and those slides and the recording are now available on the website, and they walk you through each individual page in the reporting portal. So if you want to take a look at what it looks like, I strongly encourage you. That takes about an hour, but to go ahead and take a look at that, and you can get a sense of what the portal looks like before you have to actually go in there. I want
to just point out real quick there. But the subsequent presentations have included things like presentation of examples of calculations. These are the presentations that occurred just a couple days ago, and they have yet to publish those slides or make the recording available. So that's, when we're recommending you don't want to be the first in, they're still providing examples to the provider community on how to calculate lost revenue. We're still reviewing those and trying to funnel that information back to you. And so that's why we're recommending, it's just, I do think there's some risk to trying to jump in early that something may change, in the next couple of weeks.
And so if you want to get an understanding of how the portal works, you can just go through that tutorial, and it will show you what every page looks like, and the user guide will help you as well. It's about 70 pages, so there's a lot of information there. There is a reporting tutorial as well, which you can listen to. It's a little 30-minute, I think, maybe 20 to 30-minute tutorial that you can listen to. You can also see some data entry worksheets. They presented those on the website in Excel that you can use to help prepare for reporting. So you can start using those to kind of get your information documented and in the right place and get ready for reporting. There's a stakeholder toolkit and a one-page summary of the stakeholder toolkit. That's available on the website. There are links to the frequently asked questions that are specific to the reporting and auditing part of this PRF reporting process. And there's a toll-free provider support line that's open from, I'm trying to remember when it's opened. It's like, it has some pretty significant hours that it's available.
It's 8 a.m. to 10 p.m. Central.
Okay, yes, Central Time. And so you can, use that, because if you have a question, chances are pretty good somebody else has a question, and that will help flesh out all of these details if we raise these with the government, so we know, hopefully, we'll have everything ironed out by the time we have to report. And this next couple of 2 or 3 slides are just going to highlight some of the payments that were received that you need to think about. I mean, when you look back at this, there was a lot of money coming out in these providers, the PRF payments and stimulus funds and all the rest of it. So to get an idea of what happened during the period from April to June 30th, we had the general distributions in April, the phase 1 Medicare payment, the kind of the one that we didn't ask for but showed up in our bank account. And then we had some targeted distributions as well. We had targeted distributions in May for the rural health clinics, for high impact hospitals, for skilled nursing facilities, Indian healthcare, and then in June, another, there was one for the safety net hospitals. So there may be more than one payment that occurred in these targeted distributions in some of these categories. So you want to go back and take a really careful look and make sure you've identified everything that you're going to need to report.
So
now in this,
Claudia, we have one thing we're right. By looking at this and looking at the dates you received your payments, you should be able to identify whether it was a general distribution or a targeted distribution. Right. We also have a question, Claudia, from the floor about skilled nursing facility relief payments, and they're specifically referencing the flat amount plus a per bed amount. And are those considered infection control distributions? So,
no, those are considered targeted distributions. So they fall in this category. Those were payments. The ones you're talking about likely came in May of 2020. So those are targeted distributions.
So looking at this table, and this just mirroring some information that's on HHS website, you can look at the dates you received the payments, and that's going to help you separate into what were infection control payments, what were targeted distributions, and what were general distributions. So,
and I'm gonna double check that answer on the just to make sure in that first reporting period. There was a nursing home infection control payment here that was made in August. You'll note it's on this slide. So during the period from July 1st, 2020 through December 31st, 2020, which is our second reporting period, we had phase 2, which covered Medicaid and CHIP providers. We had phase 2, which also encompassed dental providers. Phase 3 included assisted living providers. So the first 2 payments were made in July, Medicaid, CHIP, and dental, and then assisted living providers got payments in September. And then there was a third round in phase 3 general distributions that was made in November of 2020. So all of those are considered to be general distributions. In addition to that, there were targeted distributions for children's hospitals. And this is nursing home infection control. There was a targeted payment in August of 2020 that is related to nursing home infection control.
So you would want to separate it. If you're yes. a SNF operator and you got multiple targeted payments, you're going to need to look at the dates those payments were received to separate out which are which. So.
And in addition to that, the QIP payments came out September, October, November, and December. So, that's something you're going to also have to, report if you were one of the nursing homes that received those payments.
Excellent. All right.
Okay, and I think this is where Andrew picks up.
So responsibility for reporting. So now the next several slides are going to take us through kind of the responsibility for reporting, some of go over the different thresholds, once again, at a high level, just trying to give you an overview of all the changes. So responsibility for reporting. So this is a question we're getting a lot right now as people are trying to get in and register. They're trying to figure out who has to register, what entity, does the parent register, do the subsidiaries register? So the reporting entity is defined as the entity that registers its TIN and reports on payments. And so who has to register? Many of you may operate in consolidated entities that there's a parent, there are multiple operating companies. And so the type of distribution you receive is going to drive which entity has to be registered. So if you are a general distribution recipient only, whether you're a parent and subsidiary organization or just a single entity, you typically just have to register at the parent level. But if you are received a targeted distribution recipient, and going back, you can go back to those slides, and so that's going to include your nursing home targeted payments, your SNF infection prevention control payments. Any targeted distribution recipient is going to be a reporting entity. So if you receive those targeted payments, you are going to have to register and report those payments at the subsidiary level. And so that's important to keep in mind when you're registering. So, and specifically, the guidance is that the parent entity may not report on targeted distribution payments received by a subsidiary. So you have to report those. Claudia, any other comments there?
No, I think that's good.
All right. What must be reported? So your PRF usage has to be reported in a certain order, and this is going to be driven a lot by the actual portal itself, because you're going to have to report in the portal in order. But we still are have a lot of providers ask questions about this. So you're going to be reporting interest earned on the PRF payments. You're going to be reporting on other assistance received. You're going to provide then information on the SNF and nursing home infection control distribution payments. Then you're going to report on the general and other targeted distribution payments. You're going to report on net unreimbursed expenses. And then finally, last but not least, you're going to report on lost revenue reimbursement. And we're going to go through these in more detail.
One comment here is that we keep getting this question: can I report lost revenues first and then go to expense? And not only just are we getting them, but they were raised in the technical sessions that HRSA presented as well. So the answer to that is no. This is the order that you have to follow.
And I'll just point out, because as I think many of you know, I know a lot of you have probably participated in our PPP webinars, and this is a little different. If you received a PPP loan and have filed for forgiveness there, the borrowers in the PPP scenario had some flexibility. They could, many borrowers chose only to report on payroll costs rather than reporting on the other expense categories. Here, it's very clear. You have to report on everything. It's you don't get to just pick and choose. So if anybody was looking to try to shortcut the process a little bit, that doesn't look like it's possible. So the data elements. So big change here. We're all forging ahead, trying to figure these things out, like Mr. Frischberg here, accountant of the wild frontier. But one of the major changes in the June 11th update was we now have 12 data elements or groups of data that has to be reported. The January notice only had 5 data elements. So this is a major expansion. There's clearly a movement here towards additional detail that HHS is trying to gather. And so we're going to go over those data elements in a little more detail in the coming slides. But you've got your reporting entity overview, subsidiary questionnaires, acquired and divested subsidiaries, interest earned on PRF payments, tax and single audit information, other assistance received, SNF and nursing home infection control distribution payments, targeted and general distribution payments, net unreimbursed expenses, lost revenues, and then personnel, patient, facility metrics. And there's a survey at the end of the reporting portal process.
Which was probably not a good idea for them to put it at the end after you go through all of this. You might have a few comments you want to make when you get to that point.
So the first couple elements, we're not going to go through these in a whole lot of detail. These are fairly basic. You're going to be pretty comfortable with these. Reporting entity overview, subsidiary questionnaire. They are going to ask you the TINs of subsidiaries and payments. So obviously their HHS is wanting to link, if they've got subsidiaries reporting on targeted distributions, they're going to want to be able to link those with the parents and make sure that all the reporting is getting handled correctly. There's questionnaire. You all right? Everything all right? Questionnaire on
sorry about that. I'll just mute myself in case.
questions that are acquired or divested subsidiaries, interest earned on PRF payments, and tax and single audit information. And we're going to talk about the single audit requirements and the changes to the single audit requirements at the end of the presentation here. Try to spend a few minutes there. Element 6, other assistance received. So this is a big one, and one we're getting a lot of questions about. You are required to report all other assistance that you receive. And so this is going to include Department of Treasury and Small Business Administration assistance. Some of you may have been recipients of the EIDL grants. That's the Economic Injury Disaster Loan Program grants. Many of you may have received a Payroll Protection Program loan and have been forgiven. Almost everybody that had a Payroll Protection Program loan now has either applied for forgiveness and been forgiven, or somewhere in that forgiveness process at this point. So if you had a loan that was forgiven, that is essentially now a grant, and you're going to need to report that as other assistance received. Assistance received through FEMA. Some of you may have received money through FEMA programs, HHS CARES Act testing, local, state, and governmental assistance. I know, for example, we have a lot of clients in Tennessee that received supplemental payments through the Tennessee Medicaid program. Those are going to be, that's going to fall into that bucket of other assistance received. And then business insurance, I've yet to find anybody that's been able to make a valid business income loss claim because of COVID. Most policies are written such that they exclude those, but the government still puts that in here. And then just that broad bucket of any other assistance. So you're going to have to report any other dollars you received outside of patient care revenue. So coronavirus expense, elements 7, 8, and 9. So these elements are all talking about the reporting of COVID or coronavirus related expenses. And so we group these together because there's a bunch of things here that kind of lump up underneath this, a bunch of guidance that follows that is very common throughout these. But element 7 is the SNF and nursing home infection control distribution payments. And so, once again, as Claudia said, this was a major change now. We have to report on these funds, and very importantly, the expenses that we can use to offset these funds are limited to a very specific group or types of costs. So they're costs associated with administering COVID-19 testing, like our vaccination man here in our Farsight comic. If you spent money on vaccinations or on testing, that would be included here. Reporting COVID-19 test results to the local, state, or federal governments, hiring staff to provide patient care or administrative support around infection prevention control, providing additional services to residents related to infection prevention control, or any other expenses incurred to improve infection control. So you're getting the theme here. The SNF and nursing home infection control distribution payments have to be used for expenses related to infection prevention and control. And it is a carve out from element 8, which is the expenses that your general COVID related expenses. And so this is a little bit of an accounting, something to be aware of, because you can't double dip. If you report an expense under element 7 to support your use of the nursing home infection control distribution payments, you cannot include that expense under your reporting for element 8, your use of your general and targeted distribution funds. So element 8 is the expenses, the COVID-related expenses that you're using to support your use of general and targeted distribution funds, other than the infection distribution control payments. And these are just general expenditures used to prevent, prepare for, and respond to the coronavirus. That little phrase that, how many times have we repeated that, Claudia, now since April and the first terms and conditions came out? But and then element 9 is the total expense, the total net expense incurred. So you've got element 7, which is your infection control usage, element 8, which is your general and targeted usage, and then element 9, which is your total COVID-related expenses that are not reimbursed elsewhere.
And you really want to be careful, I think, with element number 8, because when you start thinking about all of your employees in administrative and department head positions who were involved in, daily meetings to discuss where everything was at this particular point, there were a lot of things going on and a lot of people who were involved in making sure that, you were able to deal with the COVID risks, and those expenses you want to make sure you don't overlook what you're able to claim.
G&A expenses are, we're going to talk about those in just a minute, but G&A expenses are in the bucket. And you can also make, if you're making cost allocation from a home office, those allocated costs, as long as they're allocated in kind of a normal and appropriate manner, can also be included in these buckets, right, Claudia?
That's right. That's right.
So identifying coronavirus related expenses. So this has been by far one of the biggest questions. And this is something we'll be going into a deeper dive in and probably a future webinar, but identifying coronavirus related expenses. So providers reporting on general targeted, or the infection control distribution payments. First of all, you can only report those expenses that are unreimbursed by other sources and that other sources are not obligated to reimburse. And there's still a lot of kind of question and confusion around exactly how you calculate what is a reimbursed expense. And we'll touch on that here. We expect there to be some additional guidance. This is one of those areas where I really think there's probably going to be some more information to come out of HHS to provide, give providers some more guidance here. Providers are required to maintain adequate documentation. So that's just what we're told, adequate documentation. It's really up to the provider to determine what's adequate. Adequate documentation to support the expenses were incurred to prepare for, and respond to the coronavirus, and that those expenses were not reimbursed by other sources. And so we're strongly encouraging our clients that, as you get ready to go into the reporting process, that you document this somehow in a memo, because we're going to talk about, just as the next bullet point here, providers are not required to submit reporting documentation. So you're just going to be reporting on numbers. You're not going to be sending in receipts. You're not going to be sending in, that kind of data, but you've got to maintain that documentation in your records. And we're strongly recommending that whoever submits probably needs to take the time and prepare a memo that kind of summarizes how these expenses were identified, how they were calculated, how the reimbursement was calculated, because if at some point now, HHS has stated that the record should be saved for at least 3 years. So there's some other folks out in the industry, Claudia, that I think are suggesting like 6 to 10 years.
Yeah,
your cost report.
Right. Right. There's, when you're keeping your documentation, the whole premise of making sure the rationale of why you incurred those expenses, or how they were computed the way you were describing. If you're not here 3 years from now, or even if you are, you might forget, well, how was it? How did we accumulate this information? So you really want to prepare yourself for auditing. If you want to get a sense of how big a focus area this is, you can go to the pandemic committee. I'll include that information in the follow-up. I didn't think about it till right now, but if you I went to their website just earlier this week, and it is unbelievable. The number of governmental organizations that are overseeing this process, who are sharing information, who are intending to do audits, etc. So you really do want to have that documentation in the event you get audited. And that might not happen for quite a bit of time from now.
Yeah, absolutely. So reimbursement by other sources. So once again, these are kind of guidance that applies to elements 7, 8, and 9. You've got to offset your COVID-related expenses by amounts received from other sources. And those other sources could include direct patient billing, commercial insurance, Medicare, Medicaid, CHIP, and other federal funds such as FEMA, uninsured program, Paycheck Protection Loan Program. And so, once again, we intend to delve into this a little in more detail. We're kind of watching the guidance and expecting to see some additional guidance on this issue as providers generate questions here. But, for example, an example that Claudia and I were talking about the other day, I think it's relatively clear. If you had a payroll protection program loan and you applied for forgiveness for that loan, you probably submitted payroll registers to support your application for forgiveness, to document that you spent certain payroll. And so if during that period of your PPP loan forgiveness, you made a hazard pay bonus, a lot of our providers were issuing hazard pay bonuses during this period. Well, if that hazard pay bonus is on the payroll report that you use to support your payroll protection program loan forgiveness, well, I think that's pretty clearly a COVID-related expense, but that was reimbursed through the payroll protection program. And so you would need to, I don't believe you can include that. But if you had a second hazard pay bonus, say in December, that was outside of the forgiveness period, that would be the sort of thing that could be a COVID-related expense that was not reimbursed by the payroll protection program loan, because the payroll protection funds would have been fully spent by that point. There's other reference in the FAQs, Claudia, I think, to providers making, a reasonable allocation of reimbursement. So, the guidance here is very, is somewhat fluffy still. We don't have a lot of clarity on what, what HHS is expecting from providers with regards to how to specifically calculate reimbursement. But clearly, we think that if it's something that you direct build for, if you build an insurer, if you build commercial insurance, for example, for a test, a COVID test, and got paid for that COVID test, you can't then use that to go and use that to support your use of infection control payments. Does that, Claudia, would you agree with that?
Yes, yes. And I see we're getting tons of questions. We want to let everybody know that we will answer all of your questions in a subsequent email, because we really appreciate how confusing this information is and how hard it is to find answers. And we're going to make very effective use of that toll-free number and the email address for submitting questions, because they need to answer these. And so we will address those.
Yep.
So don't think we're ignoring the chats.
No, please. Like I say, if you have questions, please feel free to submit them. We're going to be submitting questions. We'll work through all these and try to answer it. We may not get to them in the presentation today. So detailed thresholds for reporting. We've already talked about this a little bit. Claudia's already touched on this, so I won't spend a lot of time. Remember, you've got for both your SNF and your infection prevention control, you've got your thresholds. And so those thresholds apply to those two buckets separately. You've got your 10,000 to 499, and then you've got your 500,000 or more. If you're in that 10,001 to 499.99 bucket, you're only required to report under two general buckets: G&A expense and healthcare related expense. If you are in that $500,000 over bucket, you're reporting in greater detail. And so for those of you who have been to our other presentations, this hasn't changed a whole lot, right? This is these are the same categories that have been out there now for about a year. G&A expense, mortgage, rent, insurance, personnel, the items listed here. Healthcare includes things like supplies, IT, facilities, and that sort of thing. It is, it is important to remember that you may have hard cost capital expenditures that you are having to capitalize for GAAP purposes, but for purposes of your PRF fund reporting, you can expense and treat as an expense. So that's an example of where, you've got some departure here from how you might be treating something from a GAAP standpoint for your audited financials and how you might be treating it for PRF reporting.
And, people who've been reporting to Medicare and Medicaid probably are very familiar with this kind of accounting process. You probably have a depreciation schedule for GAAP, for tax, for Medicaid, for Medicare. Now you're going to have one for PRF reporting also.
Lost revenues. So anybody that's been paying attention to this for the last year, you probably feel like, HHS is like these pilots here, right? The fuel light's on, we're all going to die. And then they go, oh, wait, no, we didn't really mean that. We're all okay. Everybody who was watching this back last summer remembers that we went from lost revenues, to then just lost net income, which was substantially more restricted. The provider community really spoke out, and HHS subsequently walked that back and then has continued to refine that. But element 10 is your reporting of lost revenues. So you're going to be reporting revenue from patient care related sources through the most recently completed calendar year. And revenues are reported net of bad debts, and they must be broken out by quarter and payer mix. Remember that you're using the same period of availability for expenses is used to calculate your lost revenues. So you can go back. So importantly here, you can go back and look. We've had a number of clients ask this. Can you go back and for example, if I receive funds in December, can I go back and pick up lost revenues that I incurred during the second quarter of 2020? And of course, the answer is yes. That was one of the clarifications from the 720 webinar. Estimating lost revenues. Lost revenue calculations should be net of contractual adjustments and bad debt. Touched on that briefly. The other assistance received, including PRF monies, are not included in that calculation of revenues. So, once again, going back, if you've got dollars in those PRF funds, if you've got dollars like your PPP loan forgiveness and those other, you don't include those in the calculation of revenue. It's revenue from patient care related sources. If you're, this is an important clarification and something else we got questions on. When after they bifurcated the opinion, the periods, the availability periods, if you had lost revenue that exceeds the amount of provider relief funds. So let's just use a very roundabout example. If you had $500,000 in provider relief funds in period 1, those were funds received through June 30th of 2020, but you had $1 million in lost revenue in that period. The question was, could you carry that excess revenue over and use it to offset PRF funds in period 2, 3, or 4? And so there has been an FAQ that was published very recently that clarifies that. So yes, you can. So if you've got excess lost revenue, even if they were incurred early on, you can carry those forward into subsequent periods. So a number of FAQs on the lost revenue calculation. And once again, this is something that we'll probably have to build a separate webinar around to kind of dive into these questions in a little more detail. Options for estimating lost revenue. Providers have 3 options for estimating lost revenue. If you've read the guidance, you're probably familiar with these now. You've probably already started working on some of these, but option 1 is a straight up year-over-year comparison. 2019 actual to 2020 actual. Option 2 is a 2020 budget to 2020 actual. It's important to remember that there are restrictions on the type and nature of the budget that you can use. So the budget has to have been developed and approved prior to March 27th of 2020. And you're going to have somebody from the organization, a CEO, CFO, controller, somebody at that level is going to actually have to submit an attestation that the budget predates March 27th, 2020 and was approved by the entity and was in use by the entity. Just something to consider that, And then option 3 is the alternative methodology. And so this is where it gets really loose. But we see this as being really useful for, some of our smaller providers or even our larger providers that maybe don't have a formal budget approval process. Maybe you don't prepare a budget that goes in front of the board of directors and gets voted on, but you still prepare a budget, maybe somewhat slightly more informal. Maybe it doesn't actually, that never actually gets signed off. Well, that's the kind of thing that could possibly be used to support this option 3 alternative methodology. The HHS is going to make it a little more difficult for you, though. You're going to have to include a narrative document. So these are some of the things that have been clarified in recent weeks. You're going to have to submit a narrative document that describes the methodology, explaining why it's reasonable, and an explanation as to how the losses that are calculated using that methodology are attributable to coronavirus. You're going to actually have to give them a calculation of lost revenue. So you're actually going to have to demonstrate how you calculate the lost revenue. And we know, we've been told multiple times now that providers who are relying on option 3 are going to face an increased likelihood of audit. And if HRSA determines that the methodology you've employed is not reasonable, that providers will have 30 days essentially to resubmit using option 1 or 2. So some important clarifications there, especially if you're going to be relying on that alternate methodology.
Not to discourage,
Yeah, Claudia, what's that?
I was just going to say, not to discourage its use, like you said, because there are sometimes unique situations that occur with a provider. You're starting up a new line of business, or you're starting up, there could be a variety of different things. You may need to really take a look at that option number 3.
I mean, I would even emphasize that more. For many of our providers, option is really the only reasonable option. I mean, if you added a new line of business, or added, if you're a physician practice and added a physician early on in 2020, you may not have had that built into the budget. You may not have had that fully quantified anywhere, but in order to really pick up your lost revenue, you've got to, you've got to go in and present something under that option 3. We think that's really important. And so we've gotten a lot of comments from our clients. And so the last 2 elements are personnel, patient, facility metrics. So not surprisingly, the government's given out a bunch of money. They've created reporting requirements. And as part of those reporting requirements, they're going to look to get a lot of information from us. And, that's going to include clinical and non-clinical labor, number of inpatient admissions, total number of staff beds. Plus, there's going to be a survey on how you use the money. And so, we've already had a number of clients react, they feel like, man, we're just painting a big target on ourselves, because we're answering, we got this money, and then this is one of the strings. The government's going to be asking a bunch of questions about how we used it and what we did with it. And how is the government going to use those metrics going forward? We don't know that, but we know that they're asking for them, they're gathering them, they're probably going to use them somehow. The last thing we wanted to touch on here before we just jump into a few questions that were submitted prior is the deferral of the single audit. This is a big deal. And like I said, we anticipate having a whole nother webinar on this to include the audit team, but many of you are aware and are paying attention to the fact that if you spend more than $750,000 in provider relief funds, and we say spend in the context of use them to reimburse yourself for COVID-related expenses, or used it to replace lost revenue, more than $750,000 in a calendar year, you're potentially subject to the federal single audit requirement. So this would be a separate audit, separate and apart from your normal external audit that you might get for financial reporting purposes. Essentially, all our providers were looking at the money they got in 2020, and we're getting ready to have to start the single audit process for this year in 2021, because the money was received in 2020. It would have to be reported as dollars received in 2020, and the single audit process would start now. Well, new guidance was published just within the last week or two. That is
on the 15th. On the 15th.
Yeah, so within the last week, essentially deferring the single audit requirement for a year. So now, if you are a provider with a fiscal year ending between June 30, 2021 and December 30, 2021, so essentially providers with June or September fiscal year ends, you're only going to calculate your single audit exposure based on total expenditures and lost revenue in period 1. If you are a provider with a fiscal year ending on or after December 31st of 2021, but before June 20th, 29th of 2022, you're going to be reporting on total expenditures and lost revenues for periods 1 and 2. So remember, periods 1 and 2 carry you through December 31 of 2020. So essentially, if you are a provider that has a 12/31 fiscal year end, you are not going to have to report for single audit purposes. You're not going to have to quantify that $750,000 and make that determination and plan for an audit in next year, essentially. So it is essentially deferring that audit requirement for a year. And then they're going to provide additional guidance for providers with fiscal year ends ending after June 30th, 2022 related to periods 3 and 4. Claudia, anything else you want to add? I mean, that's a major deferral.
I was going to just mention that just came out on July 15th, and we sent out an alert about that. So if you are not on our mailing list for alerts, you can register on the website, and then you can you can get prior alerts as well as getting them going forward. And secondly, I think the shareholder, Allison Jones, who is heavily involved in single audit and program audits that are required when this threshold is satisfied. She is available. She's written a blog on our website that addresses this. So there's a lot more information available about that. It's just a very brief recap, but we can certainly get you more information if you need it.
But or would like change. If you're a 12/31 fiscal year end, you need to be looking at this because you may have been getting ready or getting teed up to do a single audit this fall, and that obligation may be pushed back now a year. And I really think HHS is trying to realign the fact that they are still providing guidance, as we've been discussing, on how to calculate the usage of the PRF funds. And I think there was a fundamental realization that it was unfair to ask people to determine whether they had reached the $750,000 threshold when they didn't even know what the rules were on how to use the money. So they essentially just kicked the can a year down the road. Claudia, we're almost out of time. It's 4 o'clock. We want to be really respectful. We do have a couple of quick questions. These were submitted beforehand. So Claudia, how do I appeal or dispute a decision that was made?
I think this was important. This just came out in the July 15th update. And it says HHS may recognize that providers have questions regarding the accuracy of their PRF payments, and that there's going to be a structured reconsideration process to review and reconsider payment accuracy. So this is something new that details regarding this process will be provided in coming weeks. And we've heard coming weeks so many times. I don't know. I don't think I'd hold my breath, but at some
coming weeks often turn into coming months, don't they? So, and then if a reporting entity has more lost revenue for a payment period received than received provider relief fund payments, can that lost revenue be carried forward and applied against payments received during later payment receipt periods? And we touched on this briefly, I think.
Yeah, we did. So that's the actual quoted answer from the FAQ. So,
So we do have we have a bunch of questions in the chat. It is 4:01. We do want to be respectful. We appreciate everyone taking the time to join us today. Once again, we'll be submitting a link to the webinar on YouTube, so you can go back and rewatch it, or have somebody, if you feel like it was worth enough and have somebody in your organization you want to watch it, they can rewatch it. We will be going through questions and emailing out answers to the questions. We'll also be emailing notices very soon here on upcoming webinars. Once again, we expect to have further information on the single audit requirement, on the calculation of revenue and expenses. We'll be reaching out shortly. But with that, we had a nice group today, lots of friends and clients, and we appreciate everybody coming to spend an hour with us. And we hope very much you found it useful. Claudia?
And we very much appreciate the questions too, because that's one way that we can really help flesh out and get updated information. So
thanks everybody. Hope you all have a wonderful day, and we will look forward to seeing you again soon. Thanks.
Thank you.